So what I thought we would do, folk, is just share a few slides with some general aspects of the School of Health. There are some QR codes in this, so if there's a particular topic area that you're interested in, then there's a QR code to give you a virtual tour of that bit. So should we start with some general aspects first of all? So let me pop that over there. Moira, could you just confirm that you can see that? Has that come through yet?
Yes, I can see it.
Okay, great. So by me sharing my screen, I can't quite see you anymore. So Moira, if you could help me out if there's anything in the chat room when anyone wants to ask a question. So at the start, Joe mentioned that Leeds Beckett University has 2 campuses. The School of Health is based in the city campus, nearer the city centre of Leeds, whereas the Headingley campus, which was the School of Sport, School of Education and School of Events and Tourism, they're at the other campus, that's a bus ride away. So this is just a general statement. So the School of Health itself combines a number of different courses. So let's just show you a bit of the breadth of what we do here. So anything from adult nursing and mental health nursing through biomedical sciences, which Moira's just said she studies, childhood development and play work, a series of counselling courses, courses to train dietitians, courses in environmental health, community care, health promotion, health and safety, mental health nursing, occupational therapy, physiotherapy, public health, nutrition, social care, justice and recovery, social work, sport and exercise therapy, sport and exercise medicine, and working with children and young people. So the academic staff that we have here, on the whole, will generally have come from those speciality backgrounds. So on the whole, usually the academic staff will either have a clinical background or a practice-based background, and therefore they can talk about their own topic subject groups in quite some detail. But what I really wanted to show you is some of the facilities that we have here, and here's one of the QR codes if you want to take a virtual tour of it. So if we focus first of all on working in hospital care, we have 2 of these virtual simulated wards that we have on the city campus. So next to this room that we can see on the left, there is another exact replica of that ward, and there's a nurse's station between the 2. All the equipment in that ward, in that classroom, mimics exactly what's happening in the hospitals which are very close to us. So our students straight away can really get to the right is 3 robots that we call mannequins, and again that helps us with the simulated care. So if you were to practice a technique on a patient, then it would be right and proper that you practice a technique on a mannequin, on a simulated robot, or that you might practice working alongside another student. So these wards are relatively new in the last couple of years, and they've been a great success already. But if we go completely differently, then Moira can tell us about the biomedical labs, which themselves have been expanded in the last couple of years and cover a great footprint within the Portland and Calverley buildings within our School of Health. So Moira, how many students do you imagine could be in these 2 labs at the same time?
So our entire course, because the biomedical science course were also joined by the, I think, MSc microbiology, medical microbiology, and as well as MSc biochemistry. But so all in all, I think at the beginning of the year, there was 50 of us during the induction.
Yeah.
And we're normally split. I mean, us biomedical science students, we take up all the different aspects. I mean, like we also had biochemistry and medical microbiology in our first semester.
Yes.
But I think the biochemistry students took up pharmacology, and then, yeah, basically we were separated most of the time. But
you
as
could
one, we're like,
you
yeah.
could comfortably get 50 students in one of those labs, would you say?
Normally 40. There would be
About
40 of
40.
us in. Yeah,
Okay.
about 40.
Well,
Also, I should mention, if you have time later on after the session, I did put a YouTube link there, and it's a blog that I did for showing students around the School of Health, if you want to see that later on. So
super, thank you. I think that might be in this slide. So if that's you, then let me know.
that's probably me.
It's probably you.
It is.
Good.
Right.
It's a great blog. Thank you.
Oh, thank you. So
okay, let's show what else we have. So a different set of courses now to train to be a nutritionist or a dietitian, and therefore we've got purpose-built laboratories here as well, so that our students can learn how to prepare food and with an environmental health focus to it as well. But they can practice their menus to enable our clients and service users to have a healthier diet lifestyle, whether or not they are have a comorbidity, whether they already have an ongoing condition, or if they simply want a healthier lifestyle. So those facilities, still within the School of Health, they really help. So those of you who would want to join us and have a focus on working in the healthcare sector, then one of the strengths of the School of Health is that they have a group of staff who source and provide the necessary practice placements or clinical placements in healthcare settings, and we do that on your behalf. So we source and access whichever courses, whichever placements you need. So, for instance, if you wish to train to be a physiotherapist, then we source and provide all of those placements that you would need in healthcare settings in order to train to be a physiotherapist. That's different for other universities in the country. Within the UK, some universities ask their own students to source and find the placements themselves. We do that for you, and that's a huge bonus. And we have dedicated staff in order to be able to do that. So if we just take that a step further, we are very fortunate in Leeds that we have a number of teaching hospitals, and the Leeds Teaching Hospitals NHS Trust is one of the largest teaching hospitals in Europe. And you can see there that it's made up of four different hospitals within the same umbrella. We have a number of community areas where patients and service users are looked after in their communities rather than in acute hospital settings, and we provide a number of placements for our students to be able to work there if that's what their course requires them to do. And lastly, we have a shared partnership trust with elsewhere outside of Leeds, but again, where a number of students can get necessary placements if that's what their course requires. So here's just an image of some of the facilities that we have within the School of Health to enable a well-being feeling to it. And that is some sources, social media sources you might want to access. Moira, I don't believe that I have the your blog. You jumped off. Can you put that in the chat room?
Yeah, I put it on the comment section, the link to
Okay.
the YouTube video, so they can just get back to that later.
Okay, great.
But
Well, that just gave a bit of an overview so far. We can open it up, can't we, Moira? Is there anything else that you wanted to say, particularly from your perspective?
regarding my course or the School of Health, or
I think being an international student,
yeah.
in terms of the support, what you wanted to know and what support you've gained.
Because when I do remember when I first came here, I mean, all the way back in September, I felt that I was at a disadvantage because I did work as a biomedical scientist back in the Philippines. Obviously, I was culture shocked here because I found that most of the equipment that we used in the lab, in our lab sessions, were much more advanced than I remembered. So it was a culture shock, but then all my lecturers, all my supervisors, and my course leader, they were very helpful in terms of whenever I'd ask them questions, they would literally just be one call away. And then I remember organizing a couple of tutoring sessions with them and a couple of meetings because I wanted to, because I was struggling at first in terms of it was such a culture shock coming here because it was all the equipment that we use in the lab, it's all new to me.
Yes.
So yeah, they have been very helpful, and yeah. So
Good.
So in Leeds Beckett and in School of Health, you can reach out to any of your supervisors, your course director, your course leader. They'll all be there for you if you have any questions, and they will never let you fall behind. So that's been great.
So let's just highlight that a little bit. So yes, we have course directors who look after the overall course itself. Every module will have its own academic module leader. Year groups often have a level leader to help and support the students, and every student has a personal tutor. At Leeds Beckett, we call personal tutors academic advisors. So I'll just put that in the chat because it's a slightly different term, but it's the same kind of role. So the academic advisor is your go-to person who really is there to help you succeed in your studies, and that's why they're called academic advisors as opposed to personal tutors. In terms of international support, being a newcomer, Moira, what support did you get?
So as a whole, we do have the Leeds Beckett student advice. I remember all of our deadlines were piling up around December. They were all in 1 week. And then you can actually apply through My Beckett for an extension if you really need it. So I do remember applying for one extension last year during first semester because I was struggling with basically I had poor time management around that time, but I mean, I got through that. And I was given that one extension, and I was very grateful for them. It really helped me with my situation around that time because that was a time when homesickness really hit me. So I'm just like, I couldn't do this just now. So they have been very supportive, and they gave me, and the student advice, especially the student well-being team, I think they did give me a couple of contact, like who to reach out to if ever I do go through this thing again. I can just reach out to them if I feel like I'll need help academic-wise or even outside of uni. They will be there for you. So that's been really great.
Super, good. Well, I'll just pause there for a moment and see if anyone's got any questions that they can either pop into the chat or come off on microphone and ask out. So I'll just hold back for a moment if anyone's got any questions for us.
I think somebody raised their hand.
Hello, Mr. James.
Hello.
I would like to ask you about the dorms or the living place in Leeds Bucket. Is it close to the School of Health, or it's far, or you need to take a bus or something like this?
Moira, do you want to answer that?
Yes. Actually, right now I live in Headingley. I live 15 minutes from. I walk 15 minutes to Headingley campus. So if you didn't know, there's actually a free shuttle bus that runs from Headingley campus to City campus and back. And to me, that's a lot quicker than the regular bus. I mean, you can always take the regular bus, but I find that the free bus that runs from campus to campus is a lot quicker because obviously with these buses, they will literally stop in every bus stop. So actually, I chose to live in Headingley, even though it's not exactly the most convenient for me because my campus is all the way in city center. But I chose Headingley because it gives me kind of like a peaceful vibe. It's away from the city. So to me, I think I was looking for that kind of environment where it's just everything's just all naturey and stuff. But anyway, it's not that far. And rent up in Headingley, the farther you are from city center, I think, yeah, it's a lot cheaper. So that's why I decided to stay here. But it is easy to travel to city center from anywhere in Leeds, actually. We've got the train station. The train station is about, I would say, a 12-minute walk from campus, from city campus. And yeah, there are bus stops everywhere. So wherever you choose to stay in terms of accommodation, if you are on a budget, yeah, I think anywhere in Leeds is okay. But of course, if you are living far away from city center, I would definitely recommend that you should plan your journey wisely. Plan your journey in advance. Because I remember as well, whenever I'm not taking the free bus, I would take the regular bus. The bus stop from my house is an 8-minute walk, I would say. So let's say I had 9 a.m. lectures from first semester. I would wake up at 7 a.m. and then leave at 8 a.m. because it actually takes me about an hour, not an hour, but I mean, with a 10-minute walk to the bus stop and then waiting for the bus. And it usually takes 40 minutes to travel from Headingley, from where I live, to city center. So, I mean, it all worked out at the end of the day. You just have to plan your journey wisely. And yes.
Thank you very much. Thank you.
So back to you again, Moira, because this is your course. I don't teach on biomedical sciences. So in the chat, we've got another question. Is the individual research topic selected by the academic advisor or the student?
So I think this person is, yeah, the research project, that our dissertation. Okay. So around October, that's when we were choosing our research project. So in those 3 weeks, it was allocated to supervisor meetings. So we'd have these different supervisors. I think they were like, I'm not sure, but there were loads of projects you can choose from. Some of them are non-lab based, but of course, most of them are laboratory based. But I do suggest getting a laboratory based project if you do want to pursue biomedical science in the future. It would be a great way for you to kind of like get more exposure in the lab, especially for me as an international student. I wasn't, as I said earlier today, I was very culture shocked with how advanced the equipment in the labs are. So that's why I needed more time in the lab. I needed to get used to making use of all of that equipment. So, but anyway, going back, I remember, yeah, because there's like around 40 of us, they can only allocate like a certain project to 5 students, like each supervisor, I think, depending on the research topic. So we each had to write a cover letter. It's all anonymous. So an anonymous cover letter that we had to send to our course leader, Donna Johnson. So you just have to explain in your cover letter why you want that project in particular. how will it help you in your future career? And I mean, Donna always told us not to do not sound so desperate when writing your cover letter. Just be yourself, but at the same time, of course, explain why you want that. But as much as possible, do not sound desperate. But in the end, I'm very glad that I got the research project that I wanted, which was on drug repurposing. And I'm really happy about that. And now I'm actually in the process of writing my dissertation. So I've got so that's what we're doing now up until our defense in September. So yeah.
Good, thanks for that. I've put an answer in about nutrition. So scholarships for international students in the School of Health. I can't answer that question, I'm afraid. Moyo, I don't know if you can, or if we should suggest.
It's mostly the ones I've encountered last year. Well, it's not a scholarship, but more of like a funded PhD program after your master's. That's the one Donna talked to us about. It's just I'm not exactly sure about scholarships.
No, I'm afraid we're going to have to ask you to go back to ask Joe Rossiter or Sarah Stone. I apologise, I can't answer that question.
But definitely funded PhD programs after your master's. That's what I know of.
Okay. Hi there. You're on mute.
All right, sorry. I just wanted to throw more light for international scholarship. We have for international students, general scholarship, we have £3,000 scholarship. Thank you.
Thank you very much for that.
Thank you. I think that's the international student scholarship. So I think all international students have that, but specifically for School of Health, I don't think we do. Just, yeah.
Okay, great. Another question about biomedical sciences. Are they allowed to work in the clinicals?
Okay. So for postgraduate students, that's where actually my school struggled, because apparently the MSc program is, the MSc program is IBMS accredited, but I don't think we have is it the HPC? Yeah. I don't think we have the accreditation that we need to. Yeah.
No.
But at the same time, you can get, if you're confident that you took that you covered everything during your undergrad, you can have that. You can have IBMS assess that, but then I think they come with fees. I haven't had my degree assessed yet, but that's what most of the people in my course did. So yeah, it's not I'm not sure about the UK license, but as long as your course is accredited. So it's not usually the license that they look for, but more of like if your undergrad degree is accredited. And if you want to go for that, you can have your program assessed. That's what I know of with the IBM. Yeah.
Right. So there's a question about MSc Sport and Exercise Medicine. So that course is a postgraduate, post-registration course. What that means is that it's open to people who've already qualified as a sports therapist, as a physiotherapist, as a medic, as a osteopath, as so someone who's got a clinical background, already qualified in a particular discipline, but they want to specialize in sport. So the MSc Sport and Exercise Medicine course is a 1-year full-time course to focus particularly working in the sporting environments. And it's open to people from a multitude of sporting and health related disciplines who are already qualified. So I hope that one answers that question. Right, I think those are all the questions for the time being.
Yes.
We're doing pretty well for time. We're nearly at the 1 o'clock spot. Is there any other questions from anyone?
I think we missed this. Will most of the classes be in the School of Health for nutrition? Were you able to?
Yeah, so I would say yes. I know yes, but I've put Kate Austin's email address there. If someone wants to get very specific details about how much time, they are more than welcome to contact Kate Austin, who's the course director for nutrition.
How long?
Yes, over to you, Moya.
Thank you. How long is the duration for biomedical science postgraduate? Exactly 1 year, so 12 months. I started 18th of September in last year, 2023, and I'm expected to finish around that week of September 18, 2024, because that's where our thesis defense is.
Thank you.
So exactly 1 year for postgraduates.
So what I'll just do right now is just share my screen one last time. Does that come through, Moira?
Yes, sir.
Yeah. So here's our School of Health webpage, leedsbeckett.ac.uk/School of Health. And it gives you a few tabs here, but if you want some very specific information, then look in our subjects and our courses. So biomedical sciences is fairly straightforward. Physiotherapy, occupational therapy, sports therapy, sport and exercise, medicine are in therapeutic and rehabilitation sciences, i.e. their therapies and rehabs. So I just thought I would just share that that web page for you, and hopefully that would give you an indication of how to get to that area that you're particularly interested in. Good. So health and safety and adult nursing. I can answer some of the questions. Perhaps if that link was helpful to you, that would give you some of the information that you could find.
Can we work time jobs during biomedical sciences course? Do you mean like anything anywhere related in the biomedical aspect or microbiology, or just a general part-time job? Okay, so I'll try to answer this first. My understanding of this is if you can work part-time jobs at the duration of your course, and related to, okay. So obviously it's everybody knows that international students are only restricted to 20 hours of work per week. So, I mean, you can try and look for a biomedical science related job, but usually they look for full-timers. The medical related jobs are mostly looking for full-timers, and because you're still studying and you don't exactly have the experience that most of these companies would require. I think it's doable, but I haven't heard of anyone who's done like a biomedical science related job whilst also studying a biomedical science course. So yeah. And how assignment is done in biomedical sciences. So our assignments are, well, mostly we do writing assignments and case studies. So, for example, for biochemistry, we were made to write a 3,000 word case, we were given a case study, and we had to diagnose the disease based on the patient's medical history and laboratory findings. So yeah, just mostly case studies and nothing comprehensive. It is mostly critical thinking and analysis. So that's what our assignments are mostly on. So is there a placement year for biomedical science undergraduate program? Sir James, do you know something about placements for undergrads?
Yeah, there aren't placements as such, but they get all of their necessary experience in those purpose-built labs, don't they?
Yes.
So they, to my knowledge, they don't have external placements elsewhere, but they certainly get a lot of experience on the course on campus.
We have
those couple of people who've asked about nursing and health and safety. I've put the names of the course directors and their email addresses, because I'm sure they could give much more specific answers to you than I could.
We have 20 hours working permission per ES, just 20 hours per week, but during the holidays, only during winter break and Easter holidays, that's the only time you can work up to 40 hours per week. But strictly 20 hours. Also, I must mention, if you want to work full time during the Easter holiday or winter break, you have to secure a letter from your college, from your school of health. They have to give you full permission if you can work full time, like a term dates letter, because your employer will also look for that. What does the typical timetable look for in MSc Biomedical Science? Are most of the lectures okay? So for first semester, I found that first semester was actually a lot busier than it is now. So my timetable was, if I remember perfectly, it was from Tuesday to Friday. But on Wednesday mornings, we were based in Headingley campus, but I think they're working towards that now, because most of my course mates are based in city campus, so they usually find a way around that. So Monday,
so the timetables do change year on year, so
yeah.
we can't make any promises exactly what the timetable will look like morning or afternoon, Monday to Friday,
yes,
come September. So we
but
can only say what's happened in the past. Yes.
Yeah, but expect to be in uni at least 3 to 4 times a week. You're in uni the entire day, 3 to 4 times a week, but I'm not sure about the hours. This is okay.
Right. Well, we're on to. I don't understand the question about the sport and exercise medicine. HCPS. That's not an abbreviation I know. Do you mean the HCPC, the Health and Care Professions Council? But that's not necessary to study the sport and exercise medicine course. It's a theoretical course, campus-based. There's no placement there. Do you have a break between June and September for the MSc Dietetics? I imagine so. And again, I'll have to ask you to contact that course director. And that's Lindsay is the course director for the dietetics course. Right, we're on 1:05. You're welcome to go back to the main room if you had any further questions for Sarah or for Joe. I do hope this has been helpful to you, and I'll ensure that Sarah gets the recording to you. Good. Right, I'll let you be. Thank you all very much for your time and your contributions and your questions. I do hope it's been helpful to you. All the very best to you.